Hi, this is Deborah Weinberg Newton, and I'm going to do my video on my instinctive spirometer teaching and my leg exercises. So, the first thing I would do is I would go into the room, I'd wash my hands, introduce myself, tell the patient while I was here to give them some kind of teaching on breathing exercises, instinctive spirometer, or leg exercises. Of course, I would identify the patient with 2 identifiers. And then I'd put on gloves if it's necessary, if you're touching them, or and then I would explain to the patient what diaphragmatic breathing is. It's deep breathing. I'd have them, if they could, sit on the edge of the bed, sit straight up. I would have them, and I'm going to say this like they're sitting here. I would have them, by demonstrating, put one hand on my chest and have them put one hand on their lower rib cage where their diaphragm is, and I would explain to them that this is deep breathing and your hand is up here in your chest because you do not want your chest to rise. You want to feel your diaphragm. So you deep breathe. And I would demonstrate this to them, and I would tell them that you want, like I said, the diaphragm. You want to feel the diaphragm moving, not your chest. If your chest moves up and down, you're doing it wrong. And then the instinctive spirometer usually comes in a package. You take it apart, it's got a lip right here. You put that on there, and I would teach them, like I'm telling you, this is how I would do it. I would tell them to get into a comfortable position, preferably sitting, or if they're in bed, like, Fowler's, sitting, and give them a quick overview. This is for your inspired volume. It shows you how much you're actually breathing in. This little container is a frown, a smile, and a frown. You want to keep the ball in the middle so it's smooth and even inspiration. And this is a little marker to where, say, your doctor says they want you to practice getting 2,000 mils into your lungs. Then you put it on 2,000. You set it there. You put your lips on the end of the mouthpiece, and then inspirational, you breathe in like so, and I would demonstrate like so. And you try to get your piston to your mark, and you try to keep your ball halfway where the smile is. And you do this for 2 or 3 sets of 5. Well, 5 is my number. It depends on how long the doctor wants it, and you set this according to the prescription the doctor wants them to practice for. You do not want the ball to go up and down like that, because that's not good at all. It's not helping. You want it even. You want it to be. You want it to flow smoothly. And this is to help with the breathing. This is to help bring air in and fill up the lung and get more oxygen moving into the lungs. The next is the huff cough. And with the huff cough, I'm still in their room. I would ask them to sit on their bed if they could. And the object of this cough is to hold your second. You breathe in, you hold it for 3 seconds, and then you exhale, and then you cough. So what I would teach them would be sit on the edge of the bed, and I demonstrate. Would sit on the edge of the bed, and we would breathe in, hold for 3 seconds, release, and cough. This is to get all the phlegm, all the mucus out up into the bronchos where they can spit it out, release it, cough it up. So we do that 3 times. That was my 3rd time. And depending on how many times the doctor wants them to do this, how many repetitions, that's the huff cough. The controlled cough, it's kind of like that, but with the controlled cough, you want to teach your patient to sit on the edge of the bed or in a chair and place their arms around themselves like their abdomen. And you want to lean forward a little bit, and you want to make sure that their feet are on the ground, on the floor. Now, you want to breathe in, and then as you exhale, you want to slightly lean forward and cough. So, me demonstrating to my patient, I would sit next to them or sit in the chair next to them. I would ask them to hold their abdomen. Then I would ask them to breathe in, and as they release, slightly lean forward and then cough. And you can really feel the cough on your arms when you're coughing, which is why they call it a controlled cough. And this also helps bring up anything that they have in their lungs. As far as turning in bed, I don't know how I'm going to show that. Turning in bed, I would say always get help. And use your half sheets or your bed, your spreads to help you. Also, if the patient is able to help you, let the patient help you. For example, I would teach the patient, if they are laying supine and I wanted to roll them to the right, I would ask them first to scoot their hips to the left a little bit, like this. And then I would raise their left knee, and that helps turn the patient over. You can also ask the patient to reach over and grab the handrail and help you pull the patient, help you pull them over to the side. And then you want to have some pillows to place on that side of them to hold them there. You should turn the patients every 2 hours. But I just did my paper on this that said that that's not that's not like a verified thing that you have to turn your patient every 2 hours. My paper is showing that you should turn your patient as much as they deem necessary by their situation. But anyway, that's another thing. We won't get into that. Leg exercises. If they're laying in the bed, you need to teach them to bend their knee, raise their leg up, hold it for 3 seconds or 5 seconds. I usually do 5. I don't know why. 1, 2, 3, 4, 5. And then down. And then up again. 1, 2, 3, 4, 5. And then down. You can do 5 sets of those or 3 sets of those. Or you can have them. Another one is just bring it straight up and down. And then straight up. Hold 1, 2, 3, or 1, 2, 3, 4, 5. And down. 3 or 5 sets of those. Also, you want them to make your toes to the foot. I'm going to bend so you can see. Point your toes to the foot. And to flex and extend. Flex and extend. And then you can have them do the toe circles this way, and then the toe circles up the foot. And when they do that, they don't have to hold their leg up. I was just doing that to show you so you can see it on the screen. The incentive spirometer and the deep breathing exercises help increase the oxygen in the lungs and help everything stay patent and keep the oxygen moving. The leg muscles help keep the circulation going, help keep movement in the muscles, and keep the blood flowing. So when I was a CST, what we would tell them is they're usually watching TV, sitting in the bed. What we would tell them was every time a commercial comes on, use your spirometer. Or every time a commercial comes on, do your leg exercises or your arm exercises or whatever exercises that your doctor has told you or prescribed for you. Oh, and then I would I would take my gloves off if I put gloves on and wash my hands and make sure the patient was fine and put the call light by them. And then I'd go document, because if you don't document, it wasn't done. Document my teaching.